Hello, good morning. How is everybody doing? Today, I'll quickly talk about ovarian cyst. There are a lot of questions that my patients do ask about ovarian cyst when we diagnose them with one. So we'll quickly go into it. For those who are interested in just knowing what is it, how do you treat it, I'll move to that. But I'll also give a detailed explanation of what ovarian cyst is for those who are interested in more information. Please quickly and kindly follow me as we go into this discussion. What is ovarian cyst? Ovarian cyst is a fluid filled membrane bound mass. When there's a swelling that is bound by a membrane that is found either inside the ovary or on the surface of the ovary. So that's what we call ovarian cyst. Sometimes, to be more all-encompassing, we call it an adnexal mass, because sometimes there might be tubal ovarian swelling. That's the swelling involves also the tubes. It involves both the tubes and the ovary. So that's what ovarian cyst is. So when you are told, or when you hear your mother or auntie has ovarian cyst, that's what it means. Inside her ovary, there's a swelling that is usually containing water inside. So that's it. How common is the ovarian cyst? It's actually a very common occurrence. A lot of women have a 20% risk of having ovarian cyst in their lifetime, and a lot of studies they have shown that most women who are not having any symptoms, when they just screen them, almost 18 to 8 to 18, or sometimes around 20% of those women, that's around 2 in 10 women, will be found to have ovarian cyst. Now, in order to understand the discussion further, I would like to highlight some things that can be done to be able to help prevent ovarian cyst. So if you are just interested in knowing how do I prevent ovarian cyst, you can just hang on here. But if you want detailed discussion, we'll continue with it in a bit. So what are the things that can be done for a woman to be able to prevent ovarian cyst? Or if you have one, what are the things that can be done? Most cysts in women who are between 15 to 45 are actually functional cysts, which means that they occur because of the normal ovarian function of a woman, and most of them, they will disappear by themselves within 2 to 3 cycles. You find a cyst now, after three months you check, you find out that the woman doesn't have cyst, so you don't do much. But if you need to do something for a functional cyst, things that you can do include diets are very important in preventing, and even if you have it, in reducing it help in making the cyst to resolve in time. So you eat diets that are having a lot of antioxidants and anti-inflammatory in nature. So what are those kind of diets that you can find that are anti-inflammatory in nature and having a lot of oxidants? You find things like berries, you find things like broccoli, things like greens. Any kind of vegetable that is colored generally has a lot of antioxidants. So blueberry, blackberry, green vegetables, cauliflower. If you have it around, please eat as much as you can. It helps with resolving or even preventing a woman from having um, um, ovarian cyst. Other things that are important are things like herbs, or things that we add inside food. Things like, if you are cooking, you're having ovarian cyst, to be good if you can put turmeric inside. Turmeric has some antioxidative powers. You put ginger, you put uh, green. There are teas that are also good, like the green tea. Fatty fish has a lot of also antioxidant. Those are things that are recommended to help among the food you can eat. Then you reduce stress. There are a lot of people who suggest yoga and the rest, but anything that helps you reduce stress, you try and do it. Of course, not things that are harmful to your body, not things like alcohol or smoking. You reduce things like processed meat, processed sugar. High glycemic diet generally should not be something that you should consume a lot. You shouldn't go and eat one whole mountain full of apple or gari all the time, morning, afternoon, evening. These are high glycemic index diet that even if you consume it, should as a whole, you eat one quarter of it should be the diet, the carbohydrate. One quarter should be fish, meat, that's protein. Then half of that plate should be vegetables generally. So when you eat like that, it's going to be better way of handling the 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 food that has high glycemic index. Other things you can do to prevent um, or reduce the risk of having ovarian cyst. Weight loss. If you are very weight, you have overweight or you are obese, your BMI is above 25 or above 30, is something that you need to exercise, control your diet, and make sure that your weight goes down, because eventually in the further discussion you discover that hormonal problems like polycystic ovarian syndrome that most of the times are associated with high weight. There are things that increase the risk of having um, ovarian cyst. If you smoke, you should stop. These are things you do, and you find out that your glycemic control improves. You should have good sleep. Sleep well. These are things that improve glycemic control in women. What are the other things you can do? You should have a moderate kind of exercise, not too much, but you should exercise moderately. So those are the things you do that helps. In the medical treatment, I'll go later into it. These are natural things that you can be able to do to be able to either have the ovarian cyst resolve, especially the functional cyst, or reduce the other symptoms that they produce. Now, we'll go now for people who are interested in the details of what actually is an ovarian cyst. So we move on. Now, the ovarian cysts are basically classified into two: the functional cyst and the non-functional cyst. You see me mentioning functional cyst again and again and again. So let's get into it. The functional cyst there are like 3 to 4 included in the functional cyst. They are, to understand them, we need to go through the ovarian cycle. The ovarian cycle could be categorized basically into the follicular phase and the corpus luteum phase. In between them is the ovulation. Say the follicular phase, the ovulation, the corpus luteum phase. The follicular phase, a lot of follicles, around 3 to 5, develop, sometimes more, and one of them becomes dominant and begins to secrete estrogen. Now, that estrogen is what helps, one of the things I think helps to prime the uterus for implantation. So it continues from day 1 to 14 of the menstrual cycle for most women. For some, it may vary. Now, when that happens, one dominant follicle becomes so big, and at ovulation it ruptures to release the egg that enters into the fallopian tube where fertilization occurs. Now, after ovulation, that cyst that is released, it forms the corpus luteum that begins to secrete progesterone that will eventually help with the pregnancy that should have happened. However, if a woman doesn't get pregnant, the corpus luteum also involutes. It reduces in size until it disappears away. That's the normal ovarian cycle that happens. So if a woman, for example, has a follicular phase, a very big follicle, but for some reason it did not rupture, so it will just continue to grow and grow and grow. So that's what we now call a follicular cyst. You understand? Then if a woman has a corpus luteum that formed after the egg was released, but for some reason it did not involute, but keeps on secreting and secreting and secreting, you find the corpus luteum cyst. Other things that other forms of the that could be characterized among the functional cysts are things like bleeding, hemorrhage into a normal cyst that's formed. So you find a hemorrhagic cyst. Other things could happen, especially when there is some kind of high hormones within the woman. The surrounding of the cyst gets thick. You find that mostly when you're having molar gestation, molar pregnancies. So you form a thicker luteum cyst. This also forms after ovulation must have happened because of sometimes ovulation doesn't happen. So that's what you find in a thicker luteum. So those are the functional cyst, the follicular cyst, the corpus luteum cyst, the hemorrhagic cyst, the thicker luteum cyst. So let's move on to the non functional cysts. They are basically because of a sickness. There's a pathology happening making the woman not to have ovarian cyst. What are the things that could cause non-functional cyst? Endometrioma. There's a sickness. This is possible. There's a sickness we call endometriosis, where the ovarian, where the where the endometrium, that's the inner lining of the uterus, the tissue of it is found in a place other than the inner lining of the uterus. So if it is found on the ovary, we call it an endometrioma. It can form an endometrioma. So if a woman has an endometrioma, it might grow into a cyst. So that's a sickness. So that's one. Other things can be the damaged cyst. Damaged cyst is what usually will cause a teratoma. You can see the picture of one of the surgeries we did, and we found a lot of tissues inside, but for that one we found hair, literally human hair. And I remember that time some people saying, it's witchcraft too. That if it's not witchcraft, how did it enter into that place? So it's a sickness that we find. It's a damaged cyst. You can find hair, sometimes you can find tooth, you can find bone, you can find even an eye inside a damaged cyst. That's a sickness. If you have a non-functional cyst, most of the times it's a sickness, and the treatment will usually not be the same like a functional cyst. A cyst adenoma is that kind of cyst secretes a lot of fluid inside the cyst. It can be serous, just clear fluid. Sometimes it can be mucinous, very thick, slimy fluid you find inside the cyst. Other things can be the or adnexal cysts, whether it's a tubal ovarian abscess, whether it's a tubal abscess. On scan, sometimes it just looks like an adnexal mass or a cyst. So these are the kind of non-functional cysts that could be found in a woman. Of course, some of those growth in the ovaries could be cancer. So cancer itself is a big topic that we are not discussing in this place. So that's for that. What are the things that can make a woman to have an ovarian cyst? What are the causes? I mentioned earlier the functional cyst. So any woman who is menstruating, any woman who is within 15 to 45, she's at risk of having ovarian cyst. So if a woman, you are menstruating, you can have ovarian cyst just because of that. If you have never given birth to a child, you can also higher risk of having an ovarian cyst. If you had started seeing your menstruation early, so all these things you see, there are things that expose you to the work of these reproductive hormones, especially estrogen. You are at higher risk of having an ovarian cyst. Now, what are the other things? If you're having the sickness we've mentioned earlier, you are having getting pregnant, and you are on fertility drugs, especially things like clomiphene citrates. These are things that could make you to have. In fact, clomiphene, for example, it works by increasing the number of cysts your ovary produces. So the chance that you eventually have a cyst because of that drug is high. Other drugs like tamoxifen, if you take it, you may have ovarian cyst. Ovarian cysts are very common in pregnancy. So if you are pregnant, there's high chance that you have ovarian cyst. There are other things like genetic predisposition. Some women have some genetic predisposition to ovarian cyst, especially if you have some genes, BRCA1, BRCA2 genes. It increases the risk of having ovarian cyst. If you smoke as a woman, make sure you understand you can have ovarian cyst. So smoking in women increases the risk of ovarian cyst. There are other things that increase the risk of ovarian cyst, things like molar pregnancy, as I mentioned earlier. That's you're having a pregnancy, um how do I explain it easy? You are having a pregnancy that forms and it becomes a tumor, no more a child. It's not a child that is formed. So it begins to secrete a lot of hormones. It can end up know that a woman is having ovarian cyst. Normally, um, in the hospital, we follow a system. We check the symptoms, what you tell us, the signs, then we do examination, then we do some investigation. But if you're having some symptoms, like you're having irregular menstruation today, this month it's on the 15th, next month is on the 25th, upper month is on the 1st, the other one you are just 1 month, sometimes you might not even see your period. These are things that may indicate that you have ovarian cyst. You may have low abdominal pain, you may have pain during sex, you may have discomfort, bloating. um so if you're having those kind of symptoms, you should actually, you might have an ovarian cyst. You should see a doctor for him to check. Now, what are the other things that can cause? If the cyst is big, it can cause pressure symptoms. So if it's big enough, it may make you to have low abdominal swelling. You may have constipation. You may have pressure symptoms on the bladder, so you may be passing urine very quickly, sometimes at night, many times than before. These are things that may indicate that you're having an ovarian cyst. So if you're having such symptoms, you should go and see the doctor. Because you have it doesn't mean you have ovarian cyst. There are other things that can cause it, but if you have it, please see a doctor who will do the proper thing and um, know whether it's ovarian cyst or not. For the when you come to the hospital and the doctor wants to check you, most of the times you take your history and you tell him all these things you've said. You do an examination. Sometimes if the mass is big, you can find a pelvic mass. You do most of the times a vaginal examination. Sometimes you can touch the mass and palpate it with your hand. But most of the times the common and very good investigation modality that we use to diagnose ovarian cyst is the ultrasound. Sometimes you just do ultrasound and you just find a woman has ovarian cyst. Sometimes from the symptoms you find it. So on the ultrasound, as you can see in this image, you see a sac with fluid. That black thing is the fluid inside, covered by a membrane. When you have something like this, whether on the left or on the right, sometimes you find in both, the woman has ovarian cyst. But that is not all. The ultrasound gives us other information. It gives us the size of the information. It gives us an idea of how thick the membrane is, are there septations. So for a complex cyst, which most of the times may be non-functional, you will find the wall is thin, it is thick, it will have septations, it will have loculations. Sometimes you see projections going into the 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 cyst. Sometimes you find ascites, that's fluid in the peritoneum on the scan. Sometimes you find a lot of solid parts within the cyst. These are signs on ultrasound that this is not just a simple functional cyst, but a complex cyst that is really pathology. The other, if investigations that might be done, if somebody finds especially a complex cyst, the suspicion of cancer may rise, and one of the common tests that is done to evaluate that is the CA125. It's a tumor marker. If it's high, then the chance of an ovarian cancer is very high. Recently, a lot of women will come to the hospital, they have ovarian cyst, and they will come that they want surgery. When we check on scanning, we find out that the cyst is just 3 centimeter, 4 centimeter, sometimes 4.5, 4.8 centimeter. Not giving a lot of symptoms, but they are scared. If you're having a functional cyst that is less than 5 centimeter and a non-gynecologist wants to do operation for you, please see a gynecologist. Normally, we don't operate those kind of cysts with a small that is small in size. So very important. So what do we do for functional cysts that lose 5 centimeter? Most of the times you do conservative management, which is you just wait and see. Then of course the other things I've said, the lifestyle, the sleep, the food. Once you combined with that, you find out that most women, the cyst will disappear within 2 or 3 cycles. If the cyst is between 5 to 7 centimeter, other things can be checked and see whether the person might need surgery. So, but if you're having a complex cyst that is sometimes a little smaller, 4 centimeters, sometimes surgery might be, and you have other risk factors, surgery might be suggested uh, for you. If you are post monument, that's you have stopped seeing your menstruation and you are beginning to have complex cysts, whether it's 3 or 4 centimeter. Most gynecologists may like to do surgery and remove it and check and be sure it's not cancer. Cysts are usually 7 to 10 centimeter and they are producing symptoms. There are cysts that most of the times, even if it's a simple functional cyst, surgeries are usually suggested for it. So most women, it's only 5 to 10% of women who have ovarian cysts eventually, when they are seen by professionals, will need to have an ovarian cystectomy. That's a surgery to remove the cyst. Again, if you are having acute complications, what are the acute complications that can occur? So that the ovarian cyst can cause complications. Sometimes it can twist on itself, causing ovarian torsion. If you're having that, the recommended thing is to do an emergency surgery. If you're having bleeding into the cyst, giving severe pain, you might also need surgery. If you're having a rupture with pain that keeps on increasing, they check and you seem to having a bleeding into the peritoneum, a surgery may be done to control the bleeding. So those are usually the situations that will warrant for surgery in a woman that has ovarian cyst. So if you're having ovarian cyst, functional cyst 4 centimeter, don't worry, don't kill yourself. Just do those lifestyle medications. Take green tea, take broccoli, take nutmeg, take turmeric, exercise moderately. If you are having a lot of weight, try and work on your weight. Sorry, I forgot to mention polycystic ovarian syndrome. It itself is a kind of an ovarian cyst, but it's a complex of other problems. Most women will have obesity, they will have androgenization. So when you're having that, you come for treatment. The treatment will be solely treatment for PCOS, not just the cyst. Um, um, could cause as complications infertility. Yes, especially if it's so big, it's interrupting with the menstrual cycle. Those are the kind of long-term complications that could happen. So if you're having ovarian cyst, you are not able to give birth, it's very big. Those are the things that could happen. So you need a proper gynecologist to see you and treat it. So I stop here. If you enjoyed this lecture series, please subscribe, like and share. It will help me to produce more videos. Thank you.